Hi guys, I would like to talk to you with the topic death, because for us nurses this is very important. We nurses are always on the go by emergencies, normal cause of death with children, adolescents, old people. We must be ready to perform our competencies, how to deal with these cases. What is the nurse's role in preparing death? How do we process the death of a patient? What is the death procedure for nursing? Of course, a course is needed in the nursing curriculum to help nurses prepare for the reality of patients who die under our care. What happens with the body after death? There are considerations regarding care and preparations of the body after someone dies. After a person dies, it is very important to give the family the time for the body to how they will accept the death also. So for us, it's also a question, what is really death for us? As a nurses, as a human being, what is life after death? What is death?
As oxygen ceases to flow to tissues, your cells begin to die. Muscles, initially losing their tension, relax entirely, a state called primary flaccidity. This relaxation sometimes results in the release of bodily fluids that were previously held in place by muscle contractions. Skin, deprived of fresh blood flow, takes on a pale or ashen appearance. Within mere hours, a more obvious change marks the transition into death, a process called rigor mortis. This distinctive stiffening of the body's muscles is due to complex biochemical changes occurring deep within muscle fibers. Depleted of energy reserves, the components that typically allow muscles to contract and relax become locked together. Rigor mortis usually becomes apparent first in the smaller muscles of the face and neck before progressing throughout the body. It reaches its peak intensity at around 12 hours and then slowly dissipates over the following 2 to 3 days. The body begins to cool at a predictable rate of approximately 1.5 degrees Fahrenheit per hour. This process is known as rigor mortis. Without maintaining its own heat, the body gradually adjusts to the ambient temperature of its environment. As rigor mortis sets in, another process of decomposition begins, a process called autolysis. This self-digestion occurs as cellular enzymes, no longer confined within the boundaries of living cells, escape and begin to break down surrounding tissues. The body begins eating itself from the inside. The next phase of decay, when external decomposers join the process. Bacteria, naturally present both within and on the body, begin to flourish in the post-death environment. Some environments also harbor insects that are drawn to the remains and deposit their eggs. These organisms consume the decaying tissues, transforming them in the process. Gases produced as a byproduct of their metabolism can cause bloating. As the body continues to decompose, the skin may take on a mottled greenish or purplish discoloration. Over weeks and months, the only thing left of the body is bones and teeth.
Thanks for watching, guys.